Hi all, I'm Dr. Annapurna from Sri Shankara Cancer Hospital, Bangalore. I'm a gynaec oncologist. I operate and also I take care of the preventive aspects of women cancers. So today we are going to talk about cervical cancer because January is the month of Cervical Cancer Awareness Month. So today I'm going to talk about vaccinations. Are you aware that cervical cancer can be prevented completely and there are vaccines for it, like we have vaccines for polio and all? So today I will give you some information on these HPV vaccines, what we call them. HPV vaccine means human papilloma virus vaccine. That is because it is the human papilloma virus that causes cervical cancer in women. So enough research has been done in India regarding the India and the world over regarding the HPV vaccines, and these vaccines control almost 80% of the cancers that occur because of HPV 16 and 18. Today in India we have two vaccines, Gardasil and Cervarix. Gardasil covers four variants of viruses, types of viruses, and Cervarix covers two types of viruses. Both are aggressive viruses, HPV 16 and 18, and both these viruses are covered in both the vaccines. The Gardasil vaccine has got another two viruses which contain 6 and 11, that is the low risk viruses which cause warts in women and men. So why vaccination for all of us? That's because cervical cancer is the second most common cancer in India in women today. Breast cancer is the most commonest, followed by cervical cancer. This cervical cancer occurs by sexual contact. So all the women who are sexually active for more than 3 years should get themselves examined with either a pap smear or a HPV kit to know whether they harbor any viruses that cause this cancer, which lead on to cervical cancer. We also have these vaccines now, as I have informed you, and which can be given to the women who are sexually naive, that is, who have not had sexual intercourse. So we target for vaccination the children who are in the age between 11 and 26, who are unmarried and who are not sexually active. In these children and women, young women, the protection that is offered by these vaccines is 100% almost. That means they are protected from getting cervical cancer in their lifetime. So how do we give these vaccines? Vaccines are given as an IM injection in the arm. And how frequently are they given? They are given in 3 doses, either as 0, 1 and 6 months duration, or 0, 1, 2 and 6 months duration. So there are 3 doses that are needed to be given if a child is above 15 years of age and less than 26 years of age. If the child comes between 11 and 15 years of age, then we give just 2 doses of vaccine, because that much of vaccination is enough for them. And as we have seen with many other vaccines that we take from our childhood to prevent various infectious diseases, and we do have some side effects like fever, pain and all. Similarly, the same complaints are found even with HPV vaccination. Patients can complain of pain at the injection site, or they can have redness at the area. Some people may have fainting attacks or giddiness or headache. Hence, we tell them to rest for 15 minutes, either sitting in the chair or after vaccination, or lying down on a couch after vaccination. So this is all that will be needed to get them rid of cervical cancer in future. But please remember, All those of you who have got vaccinated or going to get vaccinated should also be screened, and the screened with either a pap smear or a HPV kit throughout their life till 65 years of age. As and how safe are these vaccines? These vaccines have been given to boys and girls all over the world, almost 62 million and odd as of now. And they have realized and they have shown in Western countries that when you take this vaccination, the infection of HPV virus in the women, in the boys and girls has come down by 80%, and the incidence of this cancer occurring in this population has come down by 50%. This is the study over 10 years, and this is what they have found out. And if we continue taking this, one day will come when we can eradicate cervical cancer from India. So please go and get cervical cancer vaccination done for yourself and your children, and ask for pap smear screening and HPV testing so that you are free from cervical cancer. Why? Because prevention is better than cure. Prevention costs a few hundreds or thousands of rupees, but treatment of cervical cancer, as you're all aware, is in lakhs. On an average, it can go on to 5 to 6 lakhs of rupees. So better be aware to prevent than go for cure. So I advise everyone to get pap smear done. All the women who are more than 30 years of age to get a pap smear done every 3 years, or a HPV test done every 5 years, and all the children to be vaccinated before they get married. This will help India get rid of this deadly cancer, that is cervical cancer. Thank you.